Lead isn't glamorous. Aside from its most publicized appearances, it's not something we typically can see, nor something we always recognize as a contributor to severe health crises. Nonetheless, lead, recognized by the CDC as unsafe in any amount, continues to live all around us in our water, homes, and air. Internationally, lead contamination is a serious problem. Compared to children in high-income countries, children from middle and low-income countries have average lead levels 3 times greater and are at much higher risks of having dangerously high lead levels. Thus, those who are already socioeconomically disadvantaged bear the brunt of our failures to protect people from lead and are at greater risk for cognitive disadvantages that can jeopardize future chances for achievement. In the United States, significant steps have been taken at the federal level to reduce Americans' lead exposure, yet, much like the international inequalities, low-income individuals remain at risk for lead exposure daily. To understand more completely why lead is such an insidious issue in America even to this day, we must examine the danger it can do, who it impacts and how severely, and why it's still around despite universal condemnation. Most importantly, we should understand what's at stake and why every American should care. While the hazardous nature of lead was discovered in the early 20th century, and many of its sources were banned in the US in the latter half of the century, it hasn't yet been eliminated from the spaces in which we live, learn, and grow. 2 poignant examples of the inequity of lead hazards come from Flint, Michigan, and Jackson, Mississippi. Flint's water crisis began in 2014 after the city switched their water source without proper water treatment, causing corrosion to the pipes and leaching lead and other toxins into families' drinking water. A majority of Flint's residents are Black, and a third live below the poverty line. While higher-income residents could move out of the city when the crisis began, lower-income residents were forced to stay and suffer through the crisis. In Jackson, hundreds of parents suspect that lead infiltrated their water, and the constant boil water notices only increased the concentration of the neurotoxins in their families' drinking water. 83% of Jackson residents are Black, and a quarter live below the poverty line. The director of the NAACP's Center for Environmental and Climate Justice referred to both the Jackson and Flint water crises as discriminatory conduct against Black people and low-income individuals in violation of Title VI of the Civil Rights Act. In addition to Jackson and Flint, millions of Americans remain exposed to lead and the developmental delays that come with it. While lead was banned in potable water systems in 1986, an estimated 5.5 to 10 million lead service lines still provide water to 15 to 22 million Americans. Because of the element's previous use in paint, over half of homes built before 1978, 75% built before 1960, and 86% built before 1940 contain significant lead hazards. Moreover, lead continues to be found in ceramics, solders, batteries, and cosmetics created before and after the American bans, meaning they are often hidden dangers in homes, schools, and childcare settings. Lead can be found in the workplaces of certain industries, especially working-class jobs, including demolition, residential cleanup, factory work, mining, and construction. Without knowing it, working adults can bring home traces of lead, to which their family members become exposed. According to the Center for Disease Control and Prevention, no amount of exposure to lead is safe. Even low bloodstream lead levels below 5 micrograms per deciliter can contribute to behavior issues, learning delays, lowered IQ, hyperactivity, delayed growth, hearing issues, anemia, juvenile delinquency, and criminal activity, and other neuropsychiatric disorders. In one study, 11-year-olds with elevated lead levels had reduced social standing relative to their parents 27 years later, demonstrating lead exposure's far reach through adulthood. At low lead levels, children tend not to show symptoms apparent to a clinician or have the symptoms attributed to something else. At moderate to high levels, the effects are more common, and children may complain of non-specific symptoms like headaches, insomnia, abdominal pain or discomfort, poor attention, or loss of appetite. Lead exposure doesn't affect every person equally. Children and low-income individuals, particularly individuals at the intersection of these two characteristics, are at the greatest risk, both for exposure and for dangerous physiological effects. Young children drink more water and breathe more air per unit of body weight, so they are more severely affected by lead pipe usage, lead-painted ceramic dishes, and aircraft emissions containing lead. They also play on floors and put their hands in their mouths, potentially exposing them to particles of chipped lead paint or lead-tainted soil. Some imported toys contain lead. Additionally, children's nervous systems are more susceptible to the damaging effects of lead, and their rapid growth causes greater uptake in the body. In America, children who live in areas with more lead-contaminated soil are more likely to be low-income and Black, causing Black children to have 2.8 times the likelihood of having elevated blood lead levels. Low-income families are also more likely to live in older homes that have significant lead sources, like pipes and paint, because firstly, these homes are more affordable, and secondly, low-income individuals are more likely to lack the social capital, time, and monetary resources to either politically bargain for or personally fund the removal of lead sources. A quarter of Black children living in houses built before 1950 have elevated blood lead levels. Requiring residents to pay for lead pipe removal, as is often the case in city policy, leaves low-income individuals far less likely to remove the danger, and landlords and local officials commonly face little to no consequences for failure to enforce lead legislation in low-income communities. Chicago demonstrates this relationship shockingly well, with a positive and tight relationship between concentrated disadvantage and environmental lead contamination. Furthermore, disadvantaged neighborhoods are more likely to be adjacent to major roadways and industries with neurotoxic lead pollution. When low-income children are exposed to lead, the effects on cognitive function can be stronger and longer lasting than in higher income children, because remedial treatments are less available both medically and academically. Cognitive function is harmed most steeply in children from low-income households. The same study found that while the effects of lead are strong for low-income groups, for middle and high-income groups, the effect was not statistically significant. Looking specifically at the highest risk level, low-income kids' cognitive test scores were 12.2% lower than high-income kids, also at the highest risk level. Cortical volumes were 9.6% smaller, and cortical surface areas were 8.2% smaller on average. Vocabulary use and receptive vocabulary abilities are also impacted. Poverty itself contributed 42% of the difference, but correlates with poverty like lower parental education, enrichment, and nutrition are also likely contributors. The result of the siting of toxic infrastructure, unequal housing investment, disparate regulatory enforcement, and residential sorting that disadvantages low-income communities is feedback into the cycle of poverty. Research from Harvard demonstrates that Black children, who are already at a higher risk for poverty, have blood lead levels well above those of white and Mexican children. Children living in racially segregated neighborhoods have higher levels of lead in their blood than those in integrated neighborhoods, reflecting biased priorities for where lead removal gets carried out. The lasting presence of lead in our homes, toys, water, and occasionally foods isn't the result of any malicious intent or belief that lead isn't a problem. It is widely agreed upon that lead is a problem and that its effects are dangerous. The real issue is twofold. Firstly, it isn't agreed upon that lead is a certain type of problem, a socioeconomic one, that disadvantages certain individuals particularly sharply. Secondly, because of the lack of acknowledgement that lead is a social issue, efforts to reduce lead's presence where people live aren't intentional enough about aiding lead removal for those who can't personally finance or politically lobby for it. As previously mentioned, when residents must personally finance lead pipe removal, low-income individuals are much less likely to do so. While 2/3 of households in wealthy areas fully replace their lead pipe systems when infrastructure projects are carried out, only 1/4 of households in low-income areas do. That's a 2.3-fold difference. Again, however, this trend isn't intentional and mean-spirited, nor is the issue of lead removal especially controversial. In fact, lead removal has widespread bipartisan support. Rather, it results because lead removal is complex, expensive, and understudied. One barrier is poor record-keeping. States were not required until recently to report blood lead testing data to the CDC, making it difficult to track possible lead line locations, and many cities lack comprehensive maps of their water line systems. Additionally, since lead service lines can extend onto private property, it can sometimes take years to gather all the permissions needed to begin projects on private land. Perhaps the biggest barrier to lead pipe removal, predictably, is money. The Environmental Protection Agency estimates removal costs for individual lead pipelines to cost, on average, $4,700. With an estimated 5.5 to 10 million lines in the country, the total cost of removal for all Americans could range from $28 billion to $47 billion. President Biden's original plan for nationwide lead pipe removal proposed $45 billion directed towards the cause, but the final amount approved by Congress totaled only $15 billion, well below the lowest end of the estimated range. In October 2024, the EPA issued a rule requiring the removal of all lead pipes within 10 years, but with federal funds not covering the full expenses, states may resort to beginning line removal in areas that can afford to fund the process themselves. There is still a danger of low-income communities being left behind. Researchers estimate that removing lead drinking water service lines could protect 350,000 American children and yield $2.7 billion in future benefits. Removing lead paint from older homes of low-income families could protect 311,000 children from ingesting lead. Tougher enforcement of the EPA's rules on lead-safe renovation could protect 211,000 children born in 2010, and the elimination of lead from airplane fuel could protect over 226,000 children. Though the monetary cost is admittedly high, the benefits are huge, both in economic returns and in the moral benefit of knowing more children will be protected from pervasive neurotoxins. The Environmental Defense Fund estimates that investing in America's future by removing lead water lines would yield $22,000 per line in societal benefits like reduced mortality and disease, and the overall return would be around $3 for every dollar invested. Many legislators and government employees believe in this picture of the future, where all American children are shielded from lead in their homes, daycares, and schools. Over time, progress has been made. The federal-level Residential Lead-Based Paint Hazard Reduction Act of 1992 provided greater transparency to home buyers, requiring property owners to disclose any lead paint hazards to prospective residents. Some cities, including Madison, Wisconsin, and Newark, New Jersey, have done a model job in replacing nearly all lead service lines equitably and on private property. The bipartisan 2021 infrastructure law dedicated $15 billion towards lead water line replacement, which, although insufficient, will make significant strides in replacement. Additionally, there is the Federal Action Plan in place, which is largely dedicated to reducing children's lead exposure and improving health outcomes for affected children. Further efforts are needed to narrow in on removing lead hazards in low-income communities where they are most concentrated. Firstly, sufficient public funds must be made available for publicly funded, evenly applied, equitable lead pipe removal. These funds must be collected and dispersed at the federal level. Cities like Flint, Michigan, and Jackson, Mississippi have high rates of poverty, and residents could not afford to pay the high tax amount that would be needed to fix their water systems for good. Higher income residents have fled these cities, and redistributing the budget amassed from the remaining low-income residents without raising taxes would require taking funds from other important sources. The federal $15 billion is a promising start, but not enough to cover the total cost of removal. Secondly, funds need to be directed towards thorough mapping of lead water lines. Third, stronger enforcement strategies need to be taken up to ensure that low-income communities with low political power are not being taken advantage of by their landlords and local governments. Lead hazards in America are an issue of equity, and one that must be dealt with swiftly to ensure the highest chance of flourishing in adulthood for all children. By taking strong steps towards preventing lead contamination in all places where we live, work, and play, we can invest in a future that helps all Americans.